Hello everyone, welcome to sqadia.com, and in our last section of the lecture topic abortion, we will talk about the effects of abortion. Effects of abortion can be physical effects or they can be psychological effects of abortion. In the physical effects of abortion, usually the habitual miscarriages. Habitual miscarriages are the miscarriages which occur regularly in subsequent or consecutive pregnancies. Due to some weaknesses and due to some maternal problems, usually these habitual miscarriages occur. Then the other effects are fever is usually common, especially if there is an infection after the abortion, and if usually when there are remaining products of conception and they are missed, or if the patient is not usually regularly seeing the gynecologist, usually this happens, and as a result of that infection, fever is very common. So don't take the fever after abortion lightly. It can be due to infections or some PIDs, pelvic inflammatory diseases. Sometimes menstrual disturbances are very common. It takes a while to come back to the normal regular menstrual cycle. So this is common after the abortion, that your cycles are not very regular. Intense pain, especially lower abdominal pain, is common after abortion. Bleeding also is common after abortion. Usually, for a week or two, there is bleeding, and sometimes after that, also some spotting is also present. Insomnia is difficulty in sleeping, is also a problem. Usually the patient complain that they cannot sleep very well after abortion, and in some very extreme cases coma or loss of consciousness is also common due to maybe excessive blood loss during the process. The higher the period time, or the higher the time in gestational period when the abortion is done, these complications are serious, more and more serious. The earlier the period, the better the chances that complications or effects are less severe. Again, some other physical effects of abortion. It can lead to later on ectopic pregnancies because of adhesion formation, because of damage to, or because of pelvic inflammatory diseases. There is scarring that can lead to ectopic pregnancy. Loss of other organs, again, complications like shock can cause damage when the blood flow to the kidneys is less. This can also lead to kidney damage. Shock is also one of the complications when there is a very, very low blood supply and patient has low blood pressure, they can go into shock. Stillbirth is common. Stillbirth is in utero death, and this is diagnosed like missed abortion. They diagnosed with the ultrasound with no heartbeat. Cold sweats are common, loss of appetite, and during the procedure, perforated uterus is also a common complication, and it's a serious medical emergency. Some psychological effects after abortion is helplessness, suicidal tendencies, loss of interest in sex, loss of sense of fulfillment, and inability to forgive oneself, and mourning is very, very common. Crying spells are very common, which are signs of depression. So there is usually a short period of depression after the abortion, especially when it is abortion done on the medical grounds and the mother is not very willing to do abortion. willingnessly. So these are some common psychological effects of abortion. The nightmares are also common: loss of confidence, frustration, low self-esteem, anger, rage, self-destructive behavior. So these are again very, very common in females after the abortion. So both physically and mentally, abortion is it's a devastating process and can lead to different health issues. So this was all the physical and psychological effects of the abortion. Thank you for watching sqadia.com.